Madam Deputy Speaker. It's a pleasure to follow the Honourable Lady in this important debate and to discuss the NHS and the challenges that unfortunately it does tend to face at winter. And we should bear in mind that for decades winter has always given the NHS challenges. Clinicians have been asked not to take time off in January for decades as a result. But I spent time with a GP practice last Friday and they certainly confirmed that this flu epidemic had been one of the worst they'd seen for many years. And from a patient's perspective, it's quite wrong that those who have waited for months for perhaps it may be routine surgery, but that has an impact on their lifestyle, have to have this cancelled. So I do believe that we do need to change. But by change, I think we need to change the entire structure. And it's all very well and good for the opposition to try and write cheques that they know they would bounce. What we have to do is to reform the NHS within the resources that it has. And I think we also have to look at the ageing population that we absolutely embrace, but of course that's a challenge for us to make sure that we look after them. In the last decade, 17% of the population in this country would be over the age of 65. In this decade, it rises to 20%. In the next decade, it will be 30%. And of course, this perhaps may be the reason why we are seeing hospital admissions the last 10 years go up by 40%. And so to me, Madam Deputy Speaker, I'm delighted that the Department of Health also takes care of social care, and particularly the reform to social care. It's long overdue. I do believe we need a cross-party approach. I'm aware that every governing party tends to say that, but actually this time I would please ask all those honourable members opposite, please to rally round. There are great ideas that we can all get around. But Madam Deputy Speaker, the key part I wish to focus on in the couple of minutes I have is the pressures that are currently faced on the GP practice and the pressures that then causes our hospitals to then cope with. Too many patients are finding that they are going towards A&E because the GP surgery is not there for them. I spent the time with a GP who had just come back from a patient who he'd made comfortable in that patient's home. He could have pointed me to another part that my hospital trust covers, where that patient would have been put into hospital and would have been there for some weeks. That's not good for the patient, and it's also not good for all of those other patients who are waiting for their care. And of course, we've seen huge demand for the elderly. I still have great concerns that the social care system is set up very much on a local authority basis. It goes without saying that there are many local authorities where people retire to, where they don't have the same business rates. Therefore, we have a large degree of elderly folk, and we don't have as much business to fund them, and certainly not as much council tax. I would like the government, when they look at reform, to see if social care should be put on the same footing as a centralised NHS system. But I won't give way, I'm afraid, because of time, and I'm so sorry. But what I'd also like to see with regard to GP surgeries is more action and more powers being given either to CCGs or perhaps as a tier above, for there to be some intervention when there are GP practices that quite clearly are not functioning as they should. At the moment, there's no sharing of data, so CCGs can't see where surgeries may fall over. And I think that to expect CCGs to intervene and take over when things go wrong, I'm afraid to say, is often when it's too late. So I would like to see if there are more task forces that can be put in place. It's quite clear to me that the GP model that we continued with from 1947 is not the same GP model that younger GPs want to buy into. They don't necessarily want to buy into the practice model, they're concerned about litigation, and they don't necessarily want to stay in the same place for all those years. So I think we need great reform, and I add my support to the voices from this side and across that perhaps a Royal Commission is the way to take this forward.